What is a cochlea implant? Before talking about it, let's see how a normal ear works. Hearing is a complex mechanism. First we have the outer ear, designed for picking up sounds and having them go through the auditory canal and reaching the eardrum, a feeble diaphragm which vibrates with the sound waves. In turn, the eardrum sets in motion three tiny bones linked to the eardrum: the hammer, the anvil, and the stirrup. The stirrup is attached to a small window on a shell-shaped cavity, the cochlea, which has about 16,000 minute filaments inside, called cilia, designed to pick up a narrow frequency range. The cilia at the entrance of the cochlea pick up the high-pitched frequencies, such as the whine of a mosquito, while the ones at the end of the spiral pick up the low frequencies, such as the roar of a lion. The cilia produces pulses which are carried by a nerve, called the auditory nerve, to the cortex of the brain devoted to hearing. And the brain in turn decodes the pulses and recognizes them as sounds. But what happens if the cilia are either damaged or are not fully developed? The result can be a total hearing loss. This can be due to repetitive exposure to loud sounds, or also due to a genetic problem, or due to an infection or illness, or just due to old age. There is a very ingenious technological cure to restore hearing in these extreme cases: the cochlea implant. It's made up of two sections. The inner section, a digital receiver installed under the skin and connected via a cable directly to the auditory nerve, and the outer section, made up of a transmitter which is placed over the receiver. A pair of magnets hold the alignment of both pieces of equipment. And a microphone which can be fastened to the outer ear. The sounds are digitally encoded and sent to the receiver, which sends them to the nerve and provides a reasonable hearing capacity, even though not as good as a normal ear would do. But it does allow the patient to hear, communicate, and learn to talk, as well as normally finishing a career and lead a normal life. The implant works very well in most cases, and the results are very dramatic, totally improving the quality of life of the patient. Currently, the implant requires a costly surgery, but it's worthwhile. I hope this brief explanation has been useful to you. Thanks for watching, and please subscribe.